This is an interview with my mom, otherwise known as Dr. Karen, and it's about obesity. So, first question: what type of medicine do you practice?
I'm a family practice physician. I have been in practice in Louisville, Colorado for over 21 years. I see a wide variety of patients from newborn babies to geriatric patients and everyone in between.
So, do you see patients who are overweight?
I see patients who are overweight all the time
Hmm.
on a daily basis. And it seems as if I'm seeing more of them than I used to. I believe that the rates of obesity in this country are increasing, and I can see that in my practice. Colorado tends to be a state where there's fewer obese patients than in other parts of the country, but there are still plenty of them around.
What type of, problems do people who are overweight have?
I see a variety of health issues that I attribute to be caused by obesity or at least partly caused by them. The most common, of course, would be type 2 diabetes. That's a disease process where people who are overweight become resistant to the insulin that their body produces. And the insulin doesn't work as well to lower their sugars. And this causes high sugar levels, and people who are diabetic get all kinds of complications from the diabetes, kidney disease, heart disease, circulatory problems, and it's a real big problem. I also have a lot of patients that have sleep apnea. The most common cause of sleep apnea is obesity. Patients that are overweight have a lot of extra soft tissue in their neck area, a lot of fat that causes them to have obstruction breathing at night. They have pauses, they become obstructed and they stop breathing, and as they stop breathing, their oxygen levels drop. And if it happens repetitively throughout the night, it actually is a cause of heart disease. I also have patients that have bad arthritis in their joints. I think that being 30, 40, 50 pounds overweight contributes to the arthritis. They have more wear and tear in their joints, they wear out faster. And if they have bad arthritis pain, it limits their mobility. They can't exercise, which then makes their weight problem worse. I see patients who have gallstones on occasion, have gallbladder disease, and being overweight is a definitely a risk factor, makes you more likely to develop gallstones. And then, of course, high blood pressure, cardiovascular disease, um, and certain types of cancer are certainly more prevalent in patients that are overweight.
So, what impact does obesity have on your patients' lives?
Well, it can have a big impact. I think a lot of patients that are overweight um, have decreased mobility. They don't move around as well. They might be more likely to fall. Um, it decreases their ability to exercise, which limits their cardiovascular health. They often have poorer self esteem, maybe some depression, eating disorders associated with the way they feel about themselves. I think patients that are overweight also have higher healthcare costs. They are often on multiple medications, and financially that's expensive in addition to taking a lot of medicine, having different medications in their body.
Hmm. So, why do you think obesity rates are on the increase in the U.S.?
Probably a variety of reasons. I think probably the most common or most likely cause is decreased activity. Our world has changed. We have a lot of electronic devices. People will tend to be more sedentary. They'll sit for hours in front of a computer screen or watching videos, or they use remote controls. They use elevators. They have to do a lot less physical work, physical activity than they used to, and I think that's one reason. And then convenience. I think dietary changes have diets have changed in Americans. There's a lot fewer fresh fruits and vegetables. People go to fast food because it's quick and easy. They're a busy, stressful lifestyle, and they grab what's fast, but it's not necessarily healthy. A lot of fat, a lot of chemicals, and I think that contributes, to them being overweight, drinking too many beverages that have a lot of calories, sodas. It's just not healthy.
What do you tell your patients who are overweight?
Um, well, it's a big problem, and a lot of people struggle with it. It's not easy to deal with. I tell them to make small, simple steps, change one thing at a time, try to increase their activity, even if it means parking their car further away just so they walk a little bit more, trying to get a little more regular with their exercise, making one or two changes at a time in their diet. And even if they can achieve even a 5 or 10% weight loss, they'll feel way better. And then they get on the roll. They feel better, they're doing better, they see the results, and they start changing their lifestyle. I'm not a huge believer in medications for weight loss, for the fad diets, because those seem to be um, uh, short-term results. People improve in the short term, but it doesn't lead to long-term weight loss. They just have to really make an effort. It's got to be a lifelong effort, not to be on a diet per se, but they need to change their lifestyle.